Under the Needle, where acupuncture meets anatomy. Today, we're exploring lung 7, one of the most commonly used points in clinical practice. Lung 7, or Lieque, is located approximately 1.5 cm proximal to the wrist crease, just superior to the radial styloid process. It lies in a groove between the Brachioradialis muscle and the tendons of the wrist extensors. Palpation typically reveals a small depression along the radial aspect of the forearm. This region represents a transition zone between the distal forearm and the wrist, where multiple tendinous and neural structures pass toward the hand. Because of its location, lung 7 is closely associated with both upper limb function and sensory pathways. Beneath lung 7 lies the brachioradialis muscle, which assists in elbow flexion and forearm stabilization. Nearby are the tendons of the extensor carpi radialis longus and brevis, which contribute to wrist extension and radial deviation. The superficial branch of the radial nerve passes through this region, providing sensory innervation to the dorsum of the hand. The radial artery also runs nearby, supplying blood to the forearm and hand. Because of these relationships, lung 7 represents an important interface between muscular, neural, and vascular systems. Clinically, lung 7 is frequently used for conditions involving the wrist and forearm, including pain, tension, and overuse injuries. Because of its neural connections, it may also influence sensory signaling and motor control in the upper limb. In acupuncture practice, lung 7 is commonly used for neck stiffness and respiratory conditions, reflecting its broader role beyond the local region. These combined effects highlight its relevance in both musculoskeletal and systemic conditions. In traditional Chinese medicine, lung 7 is known as the luo connecting point of the lung channel and the confluent point of the Ren vessel. It is commonly used to treat respiratory conditions, as well as disorders of the neck and upper back. From a modern anatomical perspective, this region lies near the superficial radial nerve and key forearm musculature. The neural pathways associated with this region connect to cervical spinal segments, which also contribute to respiratory muscle function. When these perspectives are integrated, lung 7 reflects both traditional concepts of regulating breath and modern understanding of neural and musculoskeletal relationships. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.